Is it normal to have a smell during sex? Yes, I want to talk about that very topic. Now, why am I talking about this? I actually got this very question today. I figured, hey, if one person is asking me this question, somebody else probably wants to know the answer. Now, for those of you who don't know me, my name is Joshua Crawford. I've been in healthcare for about 2 decades. I was a paramedic, a flight paramedic, went to medical school, and now a medical educator. Back to this topic about smells during sex. Is it normal? The answer is it depends. Why do I say that? Well, everybody is different. So, for instance, if I take this person and this person, their body chemistry is totally different. Everybody has sweat glands and oil glands. And so, depending on, for instance, different times of the day, you know how when you first get out of the shower, you're nice and fresh and you smell one way. But then, as the day progresses, as your body temperature heats up, as you engage in physical activity, you produce a smell. For instance, depending on how long you've had on your clothing, how many skin cells are in the fabric, different sweats, oils, things like that. All of that contributes to your normal body chemistry and your normal body smell. What's something else that can affect it? Hormone levels, for instance. Let's say a female, as the month progresses, hormone levels fluctuate, for instance. Hormone levels fluctuate with age. So, all of that, there again, can contribute to how you smell as a person. What are some other things that can actually affect your individual smell? For instance, diet. Let's say you put a lot of, you season your food or cook with a lot of things like onions, garlic, let's say asparagus. All of those can contribute to your personal smell. So that's diet. Another thing is hydration. Depending on how hydrated you are, how much fluids you're consuming, especially water, that's going to affect the concentration of your sweat. You know how you take, let's say, essential oils and perfumes, right? If it's really concentrated, it's really strong, really potent, the same thing happens with your sweat. When your sweat is really concentrated like that, it actually produces a much stronger odor. So we talked about diet, we talked about hydration. Another thing that can affect it is medications. If you're taking certain medications, let's say antibiotics, that can absolutely affect your personal smell. Now, another thing is hygiene. So you remember how I said how depending on different times of the day, yes, that's going to contribute to your smell. So, for instance, if you engage in sexual activity, let's say right after work, you skip the shower, you just get straight to it. Of course, that can cause a different smell. Now, so we talked about diet, hydration, medications, all of that. Now, when it comes to hygiene, though, different bodies also contribute to different situations. So let's say you're larger, maybe morbidly obese, or you just have excess skin, you have skin folds. That's kind of a breeding ground for all types of moisture to get trapped, skin cells to get trapped. Bacteria, for instance, to get trapped, and all of that can contribute to your individual smell. Another thing is, let's say, for instance, on the male penis, if, let's say, especially in an uncircumcised male, but it can happen even with a circumcised male, where there's now debris, there's moisture that gets trapped under the foreskin. We call that smegma. Here, let's write that down for you. That's called smegma. Okay. So smegma, that can definitely produce a smell. It's kind of this whitish, yellowish kind of color that's just basically a lot of natural ingredients all together. Okay, all of that can contribute to a smell during sex. Now, when it comes to the female, the female vagina naturally has bacteria present that makes up what's called the vaginal flora. It's supposed to be there. That's perfectly normal. However, that produces a smell. So the vagina is a slightly acidic environment, and the way the vagina is made is it's naturally designed to kind of self-cleanse, to kind of maintain that pH. But what are some things that you can do to change your pH? Okay. Let's say you're a female and you're engaging in practices like douching, for instance, where you're taking fluid and introducing it into the vaginal canal. That can, of course, change the pH. So let's say you're introducing fluid. But for instance, let's say in the setting of sexual intercourse, here, in fact, let's draw this out for you. So, for instance, when it comes to the vagina, it normally has a pH. Let's say the female vagina, the pH is kind of slightly acidic, around a pH of around 4. But let's say when it comes to semen, the semen is slightly alkali, a pH of around, let's say, around 8 or so. But what happens is when semen now gets introduced into the vaginal canal, i.e., we're having sex, now what happens is the female pH starts to change. The female pH goes higher. And that, of course, that change in pH can, of course, change the smell. Okay. So we talked about things like douching, how sex itself, just actual semen getting introduced into the vaginal canal, that can do it. Other products that you could use, scented products. So they could be soaps, they could be lotions, things like that, they can definitely affect the pH and can contribute to the smell. What are some other products that people use? Let's say lubricant. So a lubricant can be beneficial, but there again, it could alter the pH depending on what type of product you're using. Now, what actually happens during sex itself? Okay, so sex from a cell standpoint, from a body standpoint, sex is actually kind of stressful on the body. Now, here's what I want you to think about. For instance, let's say if I was baking a cake, what an analogy. Let's say I'm baking a cake, right? And I'm going to put all these ingredients together. And then, for instance, I put it in the oven. I increase the temperature inside the oven, right? So, different physical reactions, different chemical reactions start taking place. And then, what happens after several minutes after things have been in the oven? It kind of releases this aroma, and then this smell kind of goes all throughout the house, right? Well, think about what happens in sex. I said it's actually very stressful on the body. So, what happens is you get really excited, heart rate starts to go up, breathing rate starts to go up, you start perspiring. Well, that's happening with each of the individual partners, for instance. Well, now this person is having chemical reactions, this person is having other reactions. When those two people come together, we have a whole different set of reactions that can create, for instance, that aroma that gets released. Now, depending on the people, that could be considered a very pleasant, a very, it could even be cause more excitement, more stimulation, and it could be a very welcome experience for some people, but for other people, not so much. Okay. Now, so what do you do about it? Or first, let's talk about what are some other health conditions that could affect it. Let's say you smoke. Let's say you consume alcohol. That, of course, can affect your underlying health and thus can affect your natural smell. What are some other things? Things like, let's say, BV, so bacterial vaginosis. So, BV, it's not considered sexually transmitted. However, when the different bacteria mix within the vaginal canal, that can definitely alter the pH and can cause bacterial vaginosis. It kind of releases this fishy kind of smell. Other things like yeast infection. So, what does that do? A yeast infection actually alters the bacteria that are able to grow, that are part of what's called the normal vaginal flora. So, if you have a yeast infection, it prevents, for instance, certain normal bacteria from being able to grow. Basically, it kind of crowds out the space. If you have a urinary tract infection, if you have a sexually transmitted illness, all of those things could contribute to your overall smell. So, what can you do to prevent this? Well, number one, take care of your hygiene. Make sure that you're laundering your clothes. Make sure you're changing your underwear often. Make sure that at least the genitals are getting washed with at least water. Have a proper diet. Make sure your nutrition is good, your hydration is good, you're limiting your alcohol consumption, not smoking. All of those things are things you can do, as well as making sure that you're getting proper checkups and healthcare screenings. Now, when do you need to do something about it and when do you not? Okay, so let's say you and your partner are engaging in sexual activity and it comes up. There's this kind of smell, and you're not too comfortable with it. You're not okay with it. Well, let me tell you, I would suggest that you absolutely have a conversation. Talk about it. But when do you talk and when do you not talk? All right, let's first talk about when do you not bring it up? During sex itself. That's not the time. So, why? Well, it's going to naturally cause the other person, to become maybe more self conscious, more self aware. They will kind of emotionally as well as physically and sexually withdraw. And that's not the outcome that you're trying to create here. So, just what I would suggest, I'm not a relationship expert. I do know the science and the medicine, but what I would suggest is have the conversation. Just make sure you're having that conversation at an appropriate time. So maybe you and your partner just go for a walk, go for a ride, and just bring it up in a non sexual environment, just kind of a neutral conversation where you two can discuss it alone. It could be simple things like we mentioned: diet, hydration, um, medications, those kinds of things. However, if it's something that does concern you, or you're noticing some changes in your own body or in your partner's body, definitely seek help from a medical professional. Now, what are some changes that you would notice? For instance, let's say if you're suddenly having a discharge that you don't normally have, or the discharge is increasing. So you've got more of it. Let's say the color is changing, the smell of the discharge is changing, the consistency. If any of those changes, you know your body. And if you're having any of those changes, of course, seek help. When you seek help, what should you expect? So, for instance, go to the clinic, go to your doctor's office, the hospital. Just seek help from a medical professional. Here's what you should expect: they're going to ask you questions to figure out how to help you. So they're going to ask you kind of questions you've probably heard before. Do you smoke? Do you use alcohol? Do you use recreational substances? All of those are just things that we ask as a part of a normal history. They will also need to ask more specific sexual history questions like: how many sexual partners do you have? What types of sex do you engage in? Whether that's vaginal, anal, oral, all of that. Whether you use condoms or don't use condoms, all of that is just normal questions that you should expect to be asked. Answer the questions honestly so that you can get the help that you deserve. Now, so they're going to do a good history. They may do a limited or comprehensive physical exam. They also may do some laboratory tests. So, for instance, they may do some blood work, look at your urine just to see if there's anything else that's going on that needs to be resolved. So, just to kind of recap what we talked about today, let's pop all this up on the screen in case you want to take a screenshot. We said, for instance, different health conditions like bacterial vaginosis. That's the one that has that kind of fishy smell. Yeast, for instance, yeast infections, urinary tract infections, and sexually transmitted illnesses. All of those can contribute to a smell. But for instance, things that affect you personally, let's say your diet, whether or not you're drinking enough water, you're properly hydrated, your sweat itself and how concentrated it is, and how long it's actually been lingering kind of on your body. Okay. For instance, we talked about like if you have excessive skin folds, that's kind of a breeding ground for all kinds of things can happen there. The same thing for smegma, which is that kind of debris, skin cells, moisture that's under the foreskin, for instance. We talked about medications, different products like scented products and different lubricants, and how your overall health as well as your sexual health can affect whatever smells you may or may not have. So I hope that answered your question, and everybody have an amazing day.